Today I want to talk about the differences between a breast lift and a breast augmentation. And at first glance that might seem a little bit obvious, but as you think about it more, it can actually be confusing. And I think it's important to really understand what it is, what is the surgery that will help you fix what's bothering you, and then you can decide if that's a surgery that's right for you or not. So let's get started. With breast augmentation, when someone says they feel saggy and they feel like their breasts used to be fuller and now they're deflated, especially up top with that sort of ski slope look, but their nipples point straight, that's someone who is a candidate for a breast augmentation, where we fill the breast, we fill that stretched out tissue with volume, with a silicone or a saline breast implant. Now, when people come and they say they feel saggy, but their nipples point down, they point toward the floor, that's the situation where we talk about a breast lift. Because no amount of breast implant or volume is going to make a nipple that points down to the floor make it point straight again. It's important that we reshape and that we tighten the breast envelope, which has been overstretched, whether from pregnancy, from just general puberty and genetics. That's where it's important to understand which surgery it is. So when you're doing your research on Google and trying to understand, is it that I'm looking for a breast lift or a breast augmentation? What's the right one for me? So in a situation of someone whose nipples point down and they're trying to get that fullness, restore that previous position of their breast, I would say it's really important to understand if you like the volume you have in a cup. If you're happy with the amount of tissue that you have in your bra cup, then a lift can help restore the shape and volume that you want. If that's not enough, if that's not what you're envisioning, then you're talking about a lift plus implants. So I'm trying to simplify in 2 or 3 minutes something that takes me an hour to explain during a consultation. And a lot of times we also have a follow-up visit. So obviously this is much more complicated than that, but this is a primer. That way, as you do research, as you look on my blog and my website, you can understand which procedure fits you. Of course, when I examine you, I'll take a look and say, hey, these are the limitations or these are the strengths of your foundation, and here's what I would recommend based on that. Now, is that in line with your goals or not? And we'll go from there.